Hi, everybody. I'm sorry for the delay for our weekly update. I've had some things going on up here with my announcement that baby was readmitted to the NICU yesterday. Um, but things are looking better already by this afternoon. They're going to redo his blood work and see how things are going. But for now, let's look to see. This is week 3. And you can see that I have changed our um, our midterm review. We're going to do that on Sunday. It will be recorded. I apologize for the inconvenience to you all, but there's absolutely no way I could do it from up here. These little videos that I make, they're taking me hours to download so that I can get them announced for you all. Um, Yes, up in upper Wisconsin certainly needs some help with their internet service for sure. All right. So now you're beginning your first week of your next set of cases. And I've been very happy with the work that you've been doing so far. Um, I just wanted to make sure that I made an announcement about. Yes, I did. Okay. I've been very happy with the work that you've been providing to me so far. Now, today is Tuesday, so I'll be looking for your first set of work tomorrow. And our week 3 content is focused on the hematologic system, blood. We start out with our devotion as we do every week, and then we have our PowerPoint video and script format. Our objectives stay pretty consistent week to week. The content of them change. Again, here's a little prompt. Get signed up for that exam. They have a certain amount of times that they have for the exams to be taken, and those slots get filled up rather quickly. So I would hate to see you miss out. It's not one of they very rarely will allow time changes. So if you don't get a date and time that works with your work schedule, you're going to have to work around it because they will not allow you to change that time. Okay, so let's look at our Real DX video cases. And again, you can see how slow it's taking to even open up this program here. Okay, we have our 3 cases, and yesterday the first drawer was open, and you should be beginning to create that SOAP note, the subjective and the objective pieces with your differential diagnoses. I'm very pleased with the way you have been writing your differentials with the rationale, and this is how you're going to do it in practice. Now, I've been in practice for quite some time, and I still have my list of differentials in the back of my head when I'm doing my patient care. And in many cases, I will have conversations with my patients about the differentials, especially in skin, because skin is one of those things. Rashes are tricky things. There are certain rashes that are pretty obvious, cellulitis, impetigo, ringworm. But there are other rashes that can be kind of, I wonder what that could be. Well, it could be a fungal infection, or it could be an irritant contact dermatitis. And I'll discuss with my patient, well, the clues that you're giving to me leads me to believe that this is what the diagnosis is. However, if it doesn't respond to treatment within 3 to 5 days, I want you to come back in. So these are exercises that you're going to continue to use as you move forward in your practice. So I think that this is a very important piece in your education, learning those differentials. And don't be afraid to think outside the box when it comes to differentials. That's okay, because sometimes you're right. I also had a couple of students, it was interesting, that said, oh my gosh, I knew that that was the diagnosis and I didn't choose it. One thing that I have learned through my career as a nurse and as a nurse practitioner is that I always follow my gut instinct. It's not always right 100% of the time, but I've got to tell you, it is right more than it is wrong. So always follow your gut instinct. If you think that it belongs in the differential diagnosis, don't be afraid to put it there. All right. And our midterm review will occur on Sunday at 7 o'clock Central Standard Time. It will be recorded, and then you'll be taking your exams. These tests are hard. I've been teaching for Olivet since 2011. I've taught many, many courses, and I have to say, and I've taught Patho in undergrad level for a different university. And I think that Patho tests are the most difficult tests that you can take in nursing. So make sure that you are prepared. Be over prepared. This is not the test you want to begin studying for the night before. Use multiple methods. You cannot just depend on the midterm review for success, because that's not going to work. The midterm review is a really good study tool, but it's by no means all inclusive of the material that you need to concentrate on for the exam. So don't be fooled by that. Make sure that you are going over the course content. These exams are developed by test banks, and the test banks come from your textbook. So I would focus on that. Now, there's so much material to read in your textbook. How the heck you can't remember all of it? I think what's really helpful is to make sure, if you haven't been able to read all of the material, to make sure that you read that summary at the end of the chapters. You get some really great information in there. Also, another good tip is you can take the midterm review that I'm going to have. I have a PowerPoint presentation, and in the slides on the PowerPoint presentation, then go back into the textbook and try to delve a little deeper into the topics that I have covered. So those are some tips that will help you with your testing. And I hope you have a great rest of the day, and I will be popping in and out. And unfortunately, this recording is probably going to take about 3 hours to upload to YouTube. So I will put it on the announcement page as soon as I can get it uploaded. So have a great day.